From Fox 10 News, this is a coronavirus update.
Within the Mobile County Health Department, and I'm pleased to be here with you today to give you an update on the COVID-19 situation and as it impacts our county, state, and world. So first I'll start out with some information, give you some data updates, and then we'll move into some information regarding Governor Ivey's Safer at Home order that was issued and reviewed yesterday. It'll go into effect Thursday at 5 o'clock. And then we'll go in and answer some of the questions that you all had sent in to us yesterday, and encourage you, if you have questions based on information shared today, if you'll just type those underneath this broadcast, we'll get those answers to you. So without any further ado, today Dr. Laura Cepeda, our Chief Medical Officer, had announced that Mobile County has passed the 1,000 case threshold as for positive cases for COVID-19 in Mobile County. And additionally, within the United States, over 1 million people have been diagnosed with COVID-19. So we know that these numbers continue to grow day by day, and just encourage the public to be vigilant in their prevention practices. So today in Mobile County, at the beginning of the day, we had 1,008 confirmed positive COVID-19 cases, with 46 deaths in Mobile County attributed to the disease. In the state of Alabama, we've had 6,779 positive cases with 242 deaths due to COVID. And to take it even further, for the United States, there was 1,015,289 positive cases with 58,355 deaths thus far. With that, we'll move into some more specific data. I know a lot of times people want to hear how the data breaks out and what it looks like as far as the demographic characteristics of the individuals. For those 1,008 positive COVID patients that we have in Mobile County, that's an increase of over 39 patients since the last time we reported this data. Of those, 124 are hospitalized. The age range for our positive cases, for 0 to 4 years old, there are 6 patients. For 5 to 24 years old, there are 84 patients. 25 to 49, 364 folks who are positive. 50 to 64 years, 271 positives. And then over 65 years old, 267 positives. The gender breakout between the two, we have 601 female positive cases, 405 male positive cases, and 1 unknown. The racial breakdown, 409 of the positives are African American, 6 are Asian, 292 are white, and 301 are other or unknown. Currently, the zip codes that we can release information about and that are experiencing the largest number of cases is 36605, followed by 36608, 36695, 36609, and 36582. I know we additionally have some other information that we usually provide, but it was not available at this time of this report due to some issues with the database. Whenever we look at the 124 patients who are hospitalized or have been hospitalized with COVID, 12 of those were between the ages of 25 and 49 years old, 34 were ages 50 to 64, and 75 were older than 65 years old. Of those patients that we know their sex, 62 were male, 62 were female, and that concludes our information on our hospitalized COVID patients. Want to just caution everyone to let them know that we are still continuing to see an upward trend in cases. It's a gradual trend, and just want to make sure that the public practices good social distancing, good infection control, cover your cough, wash your hands, stay home if you're sick, please. And when you're out, we encourage everyone to really make sure to be wearing some kind of protective face covering, but make sure that if you have children who are under the age of 2, do not put a face mask on them. Do not put a protective face covering on them. So with the governor's Safer at Home order that goes into effect at 5 o'clock tomorrow afternoon, that's tomorrow, the Thursday at 5 o'clock, It lifted some of the requirements, or it will lift some of the requirements for the original stay-at-home order. And so we have good resources that are posted on our Facebook page to reference the Safer at Home order, as well as a new frequently asked questions page that has come out that helps to clarify some of those many questions that everyone has surrounding the Safer at Home order. And so it's a simple 2-pager, breaks down what's new and what's staying the same. And then this is your FAQs page that you'll see also accessible on our Facebook page. So take a moment to look over that, please. One of the questions or a couple of questions we've gotten as a result of that is, what can we do now that we are moving into a new phase of response and a new normal, if you will. And so the health department's recommendation is that you continue to practice, good infection control, good prevention measures. Like I mentioned earlier, wash your hands, cover your cough with a tissue and throw it away. Wear that protective face covering anytime you're out in public or doing that, essential shopping. Really don't go out if you don't have to, and just observe all of the requirements that are set in place with the Safer at Home order. People want to know how we're going to continue to manage those growing cases as they occur. Public Health continues to do case contact investigations where we're getting in touch with the individuals who are testing positive and kind of backtracking to see who all they've been around before they started feeling ill, and then after they were ill to see who all else we need to contact to advise them on testing and just prevention measures that they need to be taking, as well as just paying attention to their own health to ensure that if they get sick, they know what to do to seek treatment and to also decrease the likelihood of other people getting sick. Another question we had was that the Birmingham mayor had required face masks and wanted to know if Mobile County was going to do that. At this point, the health department, are not going to mandate face coverings at this time. Our continued stance is to strongly recommend and strongly encourage the public to put on protective face coverings anytime they're going in public, anytime they're doing any of that essential retailing. Just be smart and do the things that you can to protect your own health. A lot of this is about personal responsibility and what we can do to protect ourselves and our loved ones, just to make sure that we don't get sick. Again, just want to strongly let everybody know that while we're wanting everyone to put on protective face coverings, children under 2 should not wear a protective face covering. So make sure that is not happening, please. Okay, so we'll get into some questions from April 28th. These are the questions we received on Facebook. And the first one says, we see the data for total hospitalizations statewide to date for COVID. Would it be possible to see that on a daily basis to see how many patients are currently hospitalized and watch that number increase and decrease on a daily basis? So that information is information that is reported daily to the Alabama Department of Public Health Center for Emergency Preparedness through something that's called AIMS, and that stands for our Alabama Incident Management System. Those data are not available to the public at this time, so that's why we try to give you what we are able to give you in these Facebook Live presentations and streams. So another question, how can you get tested to find out if you've had COVID-19? Husband was very sick in February with all the symptoms, tested negative. Other day, the pulmonary doctor said that they may have had it and needed to be tested. So we're hearing several people say things like this. So anybody who meets the ADPH criteria for testing can call our number at 251-410-6243. That's 251-410-MCHD 6243. And you can schedule an appointment for COVID testing at our downtown location at 251 North Bayou Street. You have to meet the criteria for testing though. And so those criteria are that the patient is symptomatic with a minimum measured fever or subjective fever or cough or shortness of breath, and the patient is hospitalized, or the patient is immunocompromised or has other comorbidities, so has other chronic illnesses, or the patient is 65 years old or older, or the patient is a healthcare worker, or the patient is associated with a long-term healthcare facility. And so some comorbidities that you may know is defined as chronic lung disease, diabetes, heart disease, chronic kidney disease, immunocompromised neurologic disorders, and pregnancy. And I know that's a lot to remember, so we will have that posted so that you can review it to see if you would meet the criteria for testing. Let's see, so we got to thank you for the daily updates. That's fantastic. So while many states are planning a gentle reopening, most will be taking temperatures at the door. While this is a good idea, it doesn't let us know if a person is carrying COVID-19 and is asymptomatic. Do you know what percentage of positive cases are asymptomatic in Mobile County who have tested positive? Okay, so a lot to unpack there. So while we know that checking is a safeguard, it's not foolproof because of asymptomatic or pre-symptomatic infection. We've learned so far from outbreaks in congregate settings that a large percentage of our COVID positive patients might have subclinical infection. We don't know, while we don't know what that percentage of the general population are infected, and we don't know what the percentage of those infected are asymptomatic. We are working, though, every day to expand our capacity for case investigation and follow-up to try and obtain that type of information so that we can then share it with you. Are all employees in restaurants required to wear gloves or just food handlers? Okay, so we have a wonderful inspection services department, and there are certain employees in restaurants who are required to wear gloves. That's all defined in our food rules, which can be located at our mchd.org website under inspection services. So that is something that we are actually looking at. I know the recommendation has been out from several places or discussed for everyone in a setting to wear gloves. We don't know that that's necessarily the way to go. I definitely would say that any restaurants and workers in restaurants need to comply with the food rules as they are written. So wear gloves. If you normally had to wear gloves, you should be wearing gloves. But the question is, if additional folks need to wear gloves in those settings, is something that the team is looking into. Really the best thing for anyone, food handler or not food handler, is to practice good hand washing and just be vigilant. Be sure to be washing your hands regularly, and probably more so than you normally would. I own a preschool. When I reopen, will MCHD advise of guidelines, or should I just refer to the CDC guidelines? So we say follow the CDC guidelines and pay close attention to the governor's new Safer at Home order that goes into effect at 5 o'clock tomorrow. We'll have the link to that order on our Facebook page, so please take a look at that. Let's see. I see that we had a drop in cases by 4, and this was yesterday. Would you agree that they should start the 14-day count of reduction of positive cases in order to move to phase 1 of reopening? Note, regardless of what the governor and mayor decides to do, following guidelines on Dr. Fauci on when to reopen my business. All right, so the answer was no from our epidemiologist. The daily number of reported cases is influenced by many factors, and we have to look at overall trends, not a minor reduction from one day to the next. And I think you'll see that guidance from the CDC and the White House and Dr. Fauci as well, is that you're looking for that continued trend downward that spans 14 days. So we can't just look at one day to the next and make a decision on that. Let's see. Okay, do you foresee schools opening in August? I've heard about a second wave. It's too soon to know. So yes, so second or third waves of infection can occur. There's a good historic document on the CDC website, and it talks about the 3 waves of influenza that occurred during the 1918 pandemic. And so if you'll Google 1918 pandemic influenza historic timeline, you'll see great graphics and really good information about how that disease went through our population in 3 separate waves, and just the tremendous impact it had over those nearly, I think, about a year is how long that took. So good website to go visit. Let's see, the virus is so small, will it pass through the cloth masks? So the answer to that is yes. The virus itself is very small, but the face covering reduces the droplet particles that spread the virus, because the virus is carried on these droplet particles. So if we can reduce the amount of droplet particles going into the air, you're reducing the amount of virus that can be spread. So they are still effective in that manner. Let's see. So MCHD, why don't you supply the citizens the proper face masks and give them to the grocery stores and essential businesses? Let's see, we strongly recommended wearing cloth masks. Okay, so cloth face coverings are not intended to protect the wearer. It's to protect those around you. They are made with simple materials that you probably have at home. I know we've talked about t-shirts and bandanas being used for protective face coverings. So we really need your help, you, the individual, to protect the health of the community. That's where the decisions you make help to impact the health and improve the health of those around you. Pandemic flu is an unprecedented event, and we need everyone pulling in the same direction to successfully get through it. So just keep that in mind. Whenever you put those masks on, it's not necessarily for the protection of your health, it's the protection of the health of those around you, and vice versa. So that is why we push that so much. Let's see. Okay, so we've had some questions again relating to the nursing homes in the community. There's been a lot of news around long-term care facilities experiencing illness among residents and employees. And so someone asked if we could tell you how many cases and deaths each one has. No, we cannot at this time, because that is protected information. We have issued several media statements, as have some of the facilities. And so we are trying to separate the data that we have on congregate cases from community cases, but it's very complex. And so we know that whenever we have, a facility that has a large number of positives, that will take our number up, but it's not necessarily a reflection of disease that is circulating within the community. So that's something to keep in mind. They had recommended, could we maybe just call something Facility A, Facility B? Possibly. We could certainly look into that. That's a good idea. So we'll see if there's more to come if we can do that. Also, do family members who are notified get to find out the number of cases at that facility, or only that there's a positive case? So family members who are on file with the residency, with the facility, will receive phone calls about positive residents. So that information is shared. So I think that brings us to the end of our questions. I know there are a few others on here that we are in the process of getting answers for. So we encourage you to check our Facebook pages regularly. We have good information coming out there. Keep tuning in to see us each weekday. Share the prevention information and do what you can to protect yourself and protect those around you. So thank you for tuning in, and we will have more information for you tomorrow. Be well.
This has been a Fox 10 News Coronavirus Update. For the latest breaking news, stay with Fox 10 News on air, online, and on the Fox 10 News app. We now join our regularly scheduled